So, my name is Lynn Givick, and I want to say thank you to my colleagues in the press for coming this evening. I have been a nurse practitioner for almost 10 years of my 30-year healthcare career. As a nurse practitioner, I have worked at Essentia Health in their psychiatry and hospitalist department for over 6 years. I am known as an advanced practice provider, or APP, along with my nurse practitioner, physician assistant, nurse midwife, and clinical nurse specialist colleagues. Delivering exceptional patient care is our passion. Without APPs, patients' access to our healthcare system would be significantly limited, and the system's ability to provide quality patient care would be severely impacted. APPs are an essential part of our healthcare system, yet we are not recognized as essential. APPs work very hard to deliver the care to that our patients deserve, despite many of us lacking a meaningful voice in the delivery of that patient care, including how many patients we see in a day, how long we can spend with each patient, and how to best help our patients navigate a daunting healthcare system. I am not only an APP, but I am a patient as well. When I visit my physician or APP, I feel an obligation to keep my visit short because I know they will likely have more patients than they can deliver the expected quality of care in a day. According to the Journal of Internal Medicine, primary care providers would need to work almost 27 hours in a day to provide all recommended preventative, chronic disease, and acute care to their patients. Our dedication to our patients causes APPs to work many uncompensated hours to make sure our patients get the care they deserve. This time is at the expense of our families or our own well-being. Burnout and moral injury among providers, including APPs, are at unsustainable levels at Essentia Health. Our workload is a top contributor, yet the expectations for the numbers of patients many of us see in a day continues to increase. This year, Essentia Health opened a new state-of-the-art hospital that cost nearly $1 billion to construct. Yet in its shadow, there are APPs who have not had raises for years. Essentia Health may say that 90% of their APPs received a raise this year, but is the 1 cent per hour raise given to a highly experienced orthopedic nurse practitioner really a raise? Or should a talented critical care nurse practitioner who worked tirelessly to care for our most vulnerable community members during the pandemic be going into their 4th year without a raise? Or should psychiatric mental health nurse practitioners be going into their 3rd year without a raise? We think not. There are hundreds of APPs at Essentia Health who are demanding to have a real voice to meaningfully advocate for our patients, to ensure physically and emotionally healthy working conditions for ourselves, and to receive appropriate compensation. Therefore, we are organizing with the Minnesota Nurses Association to achieve that goal. Members of the Minnesota Nurses Association are strong advocates for healthcare workers and for the well-being of the public. Unions are good for workers and good for the communities they serve. We ask that you stand with us as we take on the task of improving healthcare for everyone.
All right.
Hi, my name is Nisa Baim. I'm a cardiac nurse practitioner in Virginia, Minnesota. I've been with Essentia for 14 years now. So today I would like to talk about the feeling of powerlessness. This is a feeling that we all have in which you are unable to control or influence an outcome. While it is normal to occasionally feel powerless, when it continues for an extended period of time, such as in the healthcare realm, it can lead to moral distress and burnout. The APPs at Essentia have felt powerful and the lives of our patients. This is why we are seeking a collective bargaining unit. Many APPs this past year have faced decreased staffing ratios and increased expected patient encounters without our input or ability to negotiate. In one department, urgent care, Essentia added Sundays and holidays to the providers' schedules. This added 57 workdays per year, despite the fact to a very busy department that was already short-staffed. So this was despite the fact that the department, like I said, was already short providers. So it resulted in further turnover and staffing problems. Essentia has forced many departments to see more patients without increasing the number of providers to manage the workload. Management institutes initiatives that increase productivity without increasing provider pay. Many of us are forced to accept this change or to quit. Our patients experience the effects of this when they call the clinic to make an appointment and find out that their provider has left. Advanced practice providers are constantly expected to do more with less. My question is, when you are already giving Essentia your A game, how do you give even more? Forcing more patients into an already busy schedule increases the probability of medical errors and could lead to unsafe staffing or unsafe patient care. Responsible staffing and patient safety are the primary drivers for us seeking union representation. And compensation and retention go hand in hand. Essentia's lack of dialogue regarding compensation and retention for the APPs has left many of us feeling disrespected and unvalued. During a physician-provider meeting this past year, Essentia told us that they were not planning on cutting our pay. I thought, I didn't even know that was an option, and at that point, I felt powerless. Without a voice to ensure that this would never happen, I felt very powerless. So instead of cutting our pay, Essentia chose not to give those at APPs with the most experience a cost of living raise. All while senior administration got huge bonuses at the end of the year. With the cost of living skyrocketing, for many of us, this was a pay cut. Essentia cutting off the experienced APPs from receiving raises or retention incentives has led to plummeting staff retention. And here's the truth. We need our experienced colleagues. In this profession, these folks are the ones sharing knowledge and mentoring the newer and less experienced providers. These are the people we learn from. These are the people we trust to go to for advice. I know in my 14 years working with Essentia, I could not have done it without my more experienced colleagues coaching me and guiding me along the way. So we are asking the community to support us as we are seeking a collective bargaining unit so that we may have a voice, so that we may no longer feel powerless. Many of you trust us to provide your medical care in your time of greatest need, and treating patients is our passion. So in our time of greatest need, we are asking that you support us as we seek union representation. We ask that you trust us in knowing that this change needs to happen for the good of our community, to protect our daily lives, and to improve yours. Thank you. Have a nice evening.
You gotta help her.
Sort of. Not super tech savvy, so wish me luck. All right. Hi, my name's Kelly Higgins, and I'm a physician assistant at Essentia Health. I've been with the hospitalist department for almost 10 years. I support unionizing because I know that myself and my colleagues came into this role because we were called to it, because our hearts and lives have been poured into this profession. As healthcare management becomes increasingly corporatized, I hear my colleagues losing hope for the future. A union will help us not only do the work we love, but to do it well. To protect the future of healthcare and our profession, healthcare workers need a stronger voice in the decisions being made, in the decisions that affect us all. Growing up, I knew I was going to work in healthcare. I was the kid hauling our kitchen knives out behind the shed and dissecting roadkill. And it's been commented on more than once that could have gone a number of directions, but luckily it led to healthcare. So I appreciate the support my parents gave me in that. As I got older, it's not just the body that I'm interested in, but what I love the most about my work is the human connection. The opportunity to be allowed into patients' lives, into these special moments. It is a unique privilege, and to be trusted by a patient and know that they're sharing hopes and fears, and I'm with them on that journey, it's what makes my life's work meaningful. Our motto at Essentia is that we are called to make a healthy difference in patients' lives, and it's true. Every one of us providers can tell you that this is more than just a job to us. It really is our life's work. I'm also not a stranger to being on the patient side of things. I don't think any of us are. We're all here as patients too. I happen to be the parent of a child who's had cancer twice, and I'm happy to have her standing here with me, but I'll never forget what it felt like to be on the receiving end of that news. I've lost my mom to COPD. I lost a brother to addiction and overdose. And I share these experiences because they've shaped me as a person. They've also shaped me as a provider. I understand just how vulnerable it can feel to be on the receiving end of healthcare and how much patients depend on their healthcare team. In my role as a PA, I'm providing care to the patients who are in that vulnerable place. My job is to help them to recover and maintain their health. I want patients to trust that we as providers have the time and the resources to provide them with the best possible care. Over the years, healthcare has encountered challenges: understaffing, increasing patient volumes, and changes in reimbursement by insurance companies. As healthcare management grows increasingly corporatized and hospital systems grow larger and larger, we continue to see policies enacted that are ultimately designed to increase revenue for the organization, but they come at a high cost to the providers on the ground. We're considered the revenue generators, tasked with unrealistic productivity demands, double bookings, bureaucratic tasks, and paperwork which take time away from direct patient care. Providers are stretched too thin to provide the care that we want to provide. We suffer, our families suffer, and our patients suffer when providers are burnt out. We believe that unionizing will give us the collective voice to advocate for necessary changes in our working conditions so that we can bring our best selves to work and for protection against policies that are harmful to staff and patient care. We want to provide excellent care because patients are more than just numbers to us. You're our family, our friends, and our community, and we're here to care for you. We have a passion for what we do, and we want to keep doing it well. Thank you for taking the time to hear us, and thank you for your support.
Good evening. My name is Chris Rubish, and I am the president-elect of the Minnesota Nurses Association. I am incredibly proud to be standing here with my colleagues as they announce their intention to unionize. They are taking the first steps in coming together to advocate for their profession, for their patients, and seek a greater voice in their workplace. And we are so excited to be welcoming them to MNA.